over here at the Dream Center in the medical clinic, and I'm here with Dr. Forslund. And so maybe tell me a little bit about how you got involved here with the Dream Center.
Sure. Well, I was involved from the very beginning. When the idea of the Dream Center came to light, I work in the emergency room here at Spencer Hospital, and I saw a need for people who don't have access to medical care. I saw many patients who came in, had no access to care for high blood pressure, diabetes, asthma, you name it, many things like that. So I knew that we had a need for a free clinic here in Spencer. There wasn't really anything very close to us at all. Esterville had one, but they only operated, I think, once a month. So I saw the need.
How did this part of the clinic come to be?
Okay. Well, it was a challenge, because I first explored the idea of starting my own nonprofit, my own clinic, and that was a lot of work. So fortunately, I found something called Free Clinics of Iowa. It's in Des Moines, and basically I'm part of them now. They exist to just help anybody start a free clinic. So I basically, a few simple papers to fill out, and we became part of Free Clinics of Iowa. So that's a neat thing. Actually, we're a separate nonprofit from the Dream Center, but the Dream Center hosts us, so we have all this room that is really wonderful. We wouldn't be able to do what we do without the room that we have from the Dream Center, so it's a great thing.
And I'm sure you don't do this on your own. You have to have a staff.
Oh, we have lots of volunteers. My wife is the volunteer office manager. We have at least 2 other providers that are here regularly, Dr. Roxy McLaren and Sue Brugman, who's a nurse practitioner. Several nurses. Val Curry, who is an instructor at Iowa Lakes, but she's here regularly and serves as also our lab person, and lots of other office help. So yes, it takes a team, lots of work.
So maybe what are maybe some success stories or something that makes you kind of proud about having this free clinic here?
Well, for sure, just in general. When we started, it was before the Affordable Care Act was in place, and our demand still exceeded what we could even do, really. But after that came into effect, our demand dropped a little bit. But there's still a need for uninsured people. What's been rewarding is we've done what I wanted it to do, is to treat stable chronic health problems. We're really not here often enough to take care of acute things, but it's the diabetic, the high blood pressure, the asthma. We can get them their basic medications and keep them out of the ER. And then we have occasionally found some serious illnesses. I've diagnosed 3 cancers since I've been here. People who didn't have access to care, didn't know where to go, diagnosed it. And fortunately, we got those got them on insurance so that they could get care. We couldn't do anything further here, but we could help them get the care that they needed, and that's one of the things. We can't do everything here. We do the most. We do what we can do. We try to get people the help that they need, and that's it's something. So it's satisfying to be able to do that.
Well, good. So what are the clinic hours, and kind of how does do they just walk in the door?
It's first come, first served. The free medical clinic is here the first Thursday and third Thursday every month. It opens at 2 o'clock, first come, first served. We have 16 slots. We don't usually fill them all. We have 14 to 15, so there's usually room for one more. And you can sign up between 2 p.m. and 6 p.m. So we close registration at 6 p.m. So if you're here by 6, we can get you seen.
Okay.
So, okay.
And you need to bring anything with you? I mean, just yourself?
No, we don't require, anyone can be seen here. You could have insurance, but obviously most people with insurance are going to seek care elsewhere. You don't have to bring anything. We don't turn anyone away. The other thing we provide, the Spencer Hospital provides basic lab, basic x-ray at no cost. And also we have vouchers for the $4 and $10 a month generic medications, so we can help some with medications. We can't, one thing that is frustrating is the newer, more expensive medicines we can't provide for free. I could write a prescription if you can pay for it, but we do those things. So those are good basic services that we provide here at the free medical clinic.
All right. If there's someone out there that is inspired and wants to help you out, can they help you do that?
If you're a medical provider and you're interested in volunteering, you can actually just stop up during a clinic time on one of the first and third Thursdays between 2 and 6, and then talk with Sandy Forslund, my wife, and she can help you fill out the paperwork, and we can see where you might fit in. So
All right,
Very
sounds
good.
good.
All
Thank
right.
you. Sounds
Thank
like you're
you.
doing great work here.
Thank you.